The mass shooting that happened yesterday in Minneapolis brings us back to unfortunately familiar debates like the ease of access to firearms, but it also highlights the current mental health crisis in the United States. Remember, people with mental health disorders are far more likely to be victims than perpetrators of violence. Studies have found that anywhere from 50 to 90% of mass shooters meet the criteria to be diagnosed with at least one psychiatric disorder. So it's clear that the majority of people who commit atrocities like this have mental health struggles, and it almost always turns out that they were left untreated. The US is far from realizing this as a political or societal priority. Spending on mental health represents not 0.4% of the total federal budget, but only 0.4% of the total federal health budget. And this has been cut even further in recent times. Even more crucially, there's still a big societal stigma against being labeled as mentally ill. Because of this, over 60% of people are reluctant to seek treatment. Younger generations are starting to change this, with 75% of Gen Z being comfortable discussing mental health, but clearly not fast enough. At the end of the day, political speeches rarely come with consistent public policies. Laws that could integrate mental health with preventative measures, such as red flag laws, which allow for the temporary removal of firearms from individuals deemed at risk, still face resistance. The result is a fragmented and underfunded system. Young people and minority groups are the most affected. They have less access to care and are more exposed to the emotional consequences of living in a state of insecurity, anxiety, and recurrent violence. Without solid investment, integration with policies, and true efforts to reduce stigma, the promise of solving our mental health crisis remains rhetoric rather than reality. But what's your take? Let us know in the comments down below.